How depression manifests. Differently in men versus women, how depression manifests. Depression is one of the most common mental health conditions worldwide, impacting millions annually. At American behavioral clinics, we see how depression manifests differently in men and women, influenced by biological, hormonal, and societal factors. Understanding these gender-specific symptoms, coping mechanisms, and help-seeking behaviors is crucial for accurate diagnosis and effective treatment. This guide provides actionable insights into depression symptoms in men and how depression affects women differently to enhance mental health awareness. If you're searching for symptoms of depression in men, or how depression affects women differently, you're in the right place. Depression, a gendered perspective. Depression, or major depressive disorder, involves persistent sadness, loss of interest, and symptoms that disrupt daily life. The World Health Organization notes that women are nearly twice as likely to be diagnosed with depression, yet men face higher suicide rates due to underdiagnosis. Biological factors, such as hormonal fluctuations and societal expectations, including masculinity norms and caregiving roles, shape these differences. Recognizing these patterns is key to early intervention and personalized care. Depression in women, internalized and emotional. Women often internalize depression, expressing it through emotional and cognitive symptoms. Hormonal changes during menstruation, pregnancy, postpartum, or menopause can intensify depressive episodes, as noted by the American Psychological Association. Common symptoms include persistent sadness or hopelessness, frequent crying or emotional numbness, excessive guilt or worthlessness, overwhelming self-criticism or guilt over minor issues, anxiety and rumination, persistent negative thoughts, often paired with anxiety or eating disorders. Physical symptoms, fatigue, changes in appetite, often overeating, sleep disturbances, or headaches. Emotional sensitivity, heightened tearfulness or emotional overwhelm. Women's openness to expressing emotions can lead to higher diagnosis rates, but also prolonged distress if untreated. Therapies, such as cognitive behavioral therapy, CBT, at American behavioral clinics, are tailored to address these symptoms effectively. Depression in men, externalized and behavioral. Men often externalize depression, displaying behaviors that mask the condition, leading to underdiagnosis. The National Institute of Mental Health highlights that men are less likely to seek help due to stigma or societal pressures to appear stoic. Common signs include irritability or anger, frustration or aggression instead of sadness. Risk-taking behaviors, reckless actions like dangerous driving or gambling. Substance abuse, using alcohol or drugs to cope. Social withdrawal, isolating from family or friends, often masking emotions with work or hobbies. Physical complaints, headaches, digestive issues, or difficulty concentrating. Testosterone's role in mood regulation and cultural expectations contributes to these patterns. Men may not recognize these as depression, delaying treatment and increasing risks like suicide. Help seeking. The gender divide. A critical difference lies in help-seeking behavior. Women are generally more open to discussing mental health and pursuing therapy or medication. Men, however, may avoid help due to fears of stigma, masculinity norms, or lack of awareness. While women attempt suicide more often, men die by suicide at higher rates, underscoring the need for early intervention. Breaking this stigma is essential for closing the mental health gender gap. Why these differences matter. Gender-specific symptoms can lead to misdiagnosis. Men's irritability might be mistaken for anger issues, while women's rumination may be overlooked as stress. Tailored treatments, such as CBT, mindfulness-based stress reduction, or medication, are more effective when addressing these unique presentations. Factors driving these differences include biological, hormonal variations, and brain chemistry. Societal, gender roles discourage emotional expression in men or overwhelm women with caregiving duties. Environmental, stressors like work pressure for men or postpartum challenges for women. Early recognition reduces risks like suicide and improves outcomes. Actionable steps for recovery. Self-assessment. Monitor symptoms like sadness, irritability, or physical complaints. Use online screening tools or a journal to identify patterns. Seek professional help. Contact American behavioral clinics for a confidential evaluation. We offer CBT, medication management, and support groups, Build support networks. Share your experiences with trusted loved ones or join support groups to reduce feelings of isolation. Adopt healthy habits. Incorporate regular exercise, a balanced diet, and sufficient sleep to boost your mood. Avoid alcohol and drugs. Challenge stigma. Encourage open conversations about mental health, especially for men, to normalize seeking help.